things are getting back in motion. Things, obviously, after a week of vacation, things tend to get very busy. So they have been pretty hectic and busy. But what I discovered when I came back, a lot of my patients, for some reason, they came in complaining of knee pain. Obviously, more of the geriatric population, but even the younger patients, they were complaining about a lot of knee pain. It was weird, why suddenly a lot of people felt. Maybe I was just busier than usual after a long break, so I just happened to see more patients, more concentrated population complaining of knee pains, but it was definitely something that I encountered more. Another thing that I saw people complain a lot about right now was allergies. I know we talked about before the allergy season hit, but now we are we're peaking, and a lot of people are having a very hard time with this. You can post questions if you have anything in particular that you want to ask me about that. And then the third common scenario this week was fatigue, just feeling tired. And got a saw many different people from different age groups, and they had a very interesting and a different perspective of feeling tired and their understanding of fatigue and why they didn't feel as well. And it was interesting to note what they believed was causing them to be tired, and and the underlying cause of fatigue can be so varied and so different in different people that it was very interesting to see that aspect and get to the bottom of this. So it was so far it's been just it's midweek, but it's been very interesting. So first of all, I'm going to start with knee pain. Um, Knee pain is as common in kids to young adults and people in their midlife, and obviously in the second half of their life, past their 50s. And the causes of pain in the knees can be different for different age groups. So it's important to know that sometimes it's not a big deal in terms of that it's not life threatening, or can be an issue in a bigger scheme of things, like and while sometimes it has to be you have to be careful, and you have to pay more attention to it than just take your regular Tylenol. Uh, so I'll go by age groups, generally from the youngest to the oldest. I'm not gonna obviously touch every topic. I like to keep my talks very general, so that if you're not a medical professional, what would be useful for you to know? You can obviously Google everything, but in general, in a nutshell, what will help you make a decision as to what to do next, and how much sleep to lose over it. Most of my patients, it's not the pain in the knees that bothers them, but not knowing what is causing it, and where are they going with this? Are they going to ever get better? Is it going to keep getting worse? Are they going to have surgeries? Why is it happening? They're generally healthy and they're exercising, and I think it's important for you to know what is causing this. But I think it's even more important the reassurance that it's going to get better, and obviously how long it's going to take, and what generally to expect. But until you can get those answers from your doctor, uh, you know, most of the knee pains are not life threatening, and we don't want to panic over this. But obviously not do things that are making the pain worse, like certain exercises, if you can avoid it, because a very common cause of a very common knee pain happens when you're going up or down the stairs, and then if you live in a house which has stairs, then you're really not able to avoid those. So the most common cause of knee pain in kids, young adults, is injury. Uh, Either you fall or you sprain it, you hit it somewhere, or you bend in a certain way. Many young people play soccer or any sports, and then which requires a certain pivoting action of the knee. You turning fast. A lot of people play basketball that requires certain movements, and soccer or football where there's a lot of falls, and so injury is the most common cause that you'll see. Now, depending on how bad the injury is, sometimes it doesn't become obvious right away because the knee is a complex joint and it's held together by many ligaments and everything. It's like trying to hold two things together with if you had to tie it up with rope. It has a very nice complex structure that keeps the upper and the lower leg together, and then the knee is able to do everything like going up and down the stairs, running, walking. Uh, so it's not that easy to completely destroy this joint, which can happen in motor vehicle accidents and stuff like that. But mostly you'll injure a part of it. It'll cause so much pain, won't let you walk the way you walk, or won't let you run, but you can walk. So different levels of pain or discomfort with certain movements. Generally, in younger people, that's what we are seeing, injuries. Second thing that you have to keep in mind, like especially at this time, is uh, whenever there's an injury that'll happen, that results in an inflammation in the joint. So what you will see is swelling and pain and lack of motion. If your knee can go up and down like this, wait, let me see. If your knee, if let's say this is your knee, it goes back and forth, and if you are not able to go all the way in flexion or full extension, then that's what will happen with an injury, that the pain will stop you, or there'll be some swelling in the joint that doesn't allow your knee to extend. Like instead of that, you'll just go about this much, and then the pain will stop you, and or the swelling will stop you from moving the leg anymore. These are the things you would expect to see. Now, in children, sometimes besides injuries, they're falling all the time, but besides injuries, there are certain conditions if they're limping, or the kid is not allowing to touch that leg, or you feel that they're not trying to move just because it appears to be painful for them or uncomfortable, and kids may not they may not exhibit, but you're noticing that your child is not moving as much. At that time, that's a good time to definitely see the doctor, because in very little children there are other issues. In the older kids, you see issues with growth. So when the bones they're called growing pains, but sometimes you can have certain other injuries because when kids are starting to play heavy sports, run track, and uh, they start having a lot of jumping involved, and heavy impact exercises, then they can have significant knee pain that should be looked at by the doctor. Most of the times things get better, but the key is knowing when to stop doing certain activities so that you can allow the bones or the ligaments or tendons to heal. But that's what we see mostly in younger adults. And obviously, major injuries like falling, ski accidents, soccer, sports accidents, and motor vehicle accidents, bicycle accidents, so anything like that that can obviously result in a significant issue. But I'm sure you will see the doctor if something big happened. In your middle age, like 30s to 40s to 50s, we see certain wear and tear because this is when we are not as active as we used to be. We're not regular with our activities. We are not properly warming up. We're not properly stretching. And then suddenly we go and play some sport with our kids or with our friends, or we just go to the driving range or play golf or something. And then suddenly you pull a muscle or you twist your knee in a certain way or you do something, and that results in that injury. It doesn't have to be impactful or you didn't fall, but you turned in a certain way that you can cause a sprain or a strain, and that'll result in some injury. Um, at this point, you can also see some kind of autoimmune conditions that can happen earlier in the age, but middle age is when we start seeing more of this. You want to be careful, just get it checked, especially if your knee swells up out of the blue. Suddenly you have swelling in your knee. Get it checked out. Um, and and once you're past, let's say 50 or so, we start seeing, here everybody calls it arthritis, and a lot of people will, presume that that's uh, rheumatoid arthritis, but at least in the United States, when people are saying that, oh, it's arthritis, what's arthritis? And they say, oh, it's just wear and tear, which is essentially the same as when we're trying to say arthritis. Arthritis, that means inflammation of the joint. Why is it inflamed? Because wear and tear, and every now and then something is hurting a little bit more than another time. That's when we call this arthritis, and there's different kinds of arthritis. Is basically what could be causing the inflammation in the joint. Is it osteoarthritis? That means the bones have a lot of wear and tear, and then they tend to rub against each other, and then they will cause inflammation in the joint. Rheumatoid arthritis is an autoimmune condition that also causes inflammation. So the end result, you are ending up with inflammation in the joint. But one of the things that I want you to remember is if you have an inflamed joint, you live in North America, and especially in the Northeast, and right now everybody's outdoors, so you want to get checked for Lyme disease. It's very common. I've seen it very frequently, and I've seen it missed a lot of times. And So Lyme disease is, you can have arthritis and then you can still have that. So if you're outdoors and if you're staying active, or even if you're going for a walk in Northeast America, uh, you want to be careful with the Lyme disease. If your doctor will usually remember this. In case they don't, you can always bring it up that, oh, what if it is Lyme disease? Can you check for that? And it's just a blood test, and you get that checked, and it's easy to treat. So something to keep in mind. And then as your age progresses, uh, the osteoarthritis tends to get worse, and the joint is just worn out. Fortunately, there are many treatment modalities, including a knee replacement, and people go back to almost 100% function and go back to running and everything. So that's where the knees are. What can you do? The safest medication to take is Tylenol arthritis. It's over the counter, Tylenol. I would avoid taking Aleve unless you have recently been seen by your doctor and you've been told that your kidney function is great, so you don't have to worry about that. The other thing with Aleve or ibuprofen, Advil, Motrin is it'll give you gastric reflux or acid reflux. So it's a common culprit. People will have knee pain or back pain and they start popping Advils, and yeah, the knee gets better, the back gets better. But 4 days later, I still see them, but except that they're having a lot of acid reflux. So keep in mind, like these anti-inflammatories will cause that. So you're better off taking Tylenol and icing the joint. Some people will ask me, like, is it better to apply heat, or ice? I know applying heat, especially on the lower back, it just makes it cozy and nice. But I would say that if something is just starting, you want to ice it. Ice has it reduces inflammation if it's just starting out. Like if you fell down, if you had injury, you just got hurt, or suddenly you woke up this morning, you put your foot down, and now you suddenly have this pain in a joint or in your back. Ice works better. Now, if you've had this knee pain for like 4 months, and if applying some heat on it does help, go for it. But ice will help you either ways. So medications wise, you can take Tylenol, um, and obviously if you have any liver problems, then Tylenol is not so safe. But in general, taking taking 1 or 2 Tylenols is generally safe, only because it's available over the counter, and everybody is allowed to take them without any doctor's advice, technically. But check with your doctor anyways, that hey, I'm taking some Tylenol and I'm going to be seeing you in like 3 days. Is there anything else I should be doing? And then movement. You know, any joint, whether it's your back or your knees or you're allowed to move that joint to the extent of pain. So if this was my knee, and if I can move only so much and then the pain starts, I should keep moving it up to at least this point and where it doesn't hurt, because if you're not moving your joint, it tends to stiffen up more and more. That's not what we want. So, and lastly is wrapping it. Get an ACE wrap, and it's okay to wrap any joint. And here we're talking about ankles and knees and elbows, or shoulder. But if you want to wrap, and it kind of compresses it, holds the joint in place, makes you feel better, makes you feel safer, and it reduces inflammation. So you can wrap it, ice it, and take some Tylenol. That should get you through enough time until you see a doctor, and then look for further recommendations. Um, are you worried that is it broken? Especially if you're playing soccer or something, and you're playing some sport, then the pain is so excruciating suddenly, and you're like, oh my God, like I need an X-ray to see if it's broken. Just remember, obviously, unless you fell and hit that joint hard, or did a sudden movement where there's an impact, then yes, there can be a fracture. But otherwise, most of the times, you have to remember, if you can put weight on that joint, uh, the likelihood of a fracture is lower. So that's something to keep in mind. That doesn't mean you don't need an X-ray. That doesn't mean you don't need to see a doctor. But in general, you can sleep at night and go see the doctor tomorrow. You don't have to go to the emergency tonight. And if it's your arms or anything, or if you've broken your arm, you're not going to be able to lift a cup of coffee even. Like if your bone's broken, it becomes very hard to apply any kind of force on that. So that's what we keep in mind. At an older age, when arthritis is kicking in, most of the questions are, what do we do? Because that pain is constant, it's not going away. And people have been introduced to physical therapy, people have been introduced to many medications, sometimes more than Tylenol, sometimes prescription medications, sometimes even much stronger pain medications. And I think at that point, the most important question for people is like, okay, the pain seems to be getting worse. It's never gone. It only tends to get better for a little bit. So, the modalities for that, and that can apply to younger people too. But in general, when we're talking about a pain in the joints, especially knees, is not going away, and knees are harder to deal with because this constantly you stand up and then you're putting pressure on your joint is doing the work. So we send people for we do the same thing. You can wrap it, you can take some over-the-counter medications, you can ice it, and so that'll obviously help. And then sometimes we can do an injection. Medication injections will either do some steroids. Steroids work as an anti-inflammatory medication, so steroid right into the knee joint, and that reduces the inflammation, it calms things down, the pain goes away, and or at least goes down a lot. That people start becoming more active. As soon as you start becoming more active, the muscles kick in, and then they try to hold the joint in place. And usually, people tend to do much better after these. It works most of the times, but not always. If the arthritis is severe, then one of commonly our orthopedics colleagues, they'll do a lot of gel injections into the joint. Tends to help again. For some people it works like magic, other people it doesn't, and that depends on how bad the knee was to begin with. And I just say, like, a lot of times it's worth a shot. And then last step usually is if nothing is working and your life is being overtaken by pain, and that's where you start your day with, and that's where you end your day with. Fortunately, knee replacement is a great option, and people get back to their life rather quickly. So something to consider and think about. In the meantime, there's you can also buy a lot of these gels to apply. There's the menthol gel, icy hot, Aspercreme with lidocaine, and Voltaren gel. They're all available over the counter, and they do work. They will get you through the day, and no need to panic. So these are certain things you keep in mind. Let me know if you want to go into detail about any of the things that I said, or if I wasn't clear, you want me to explain further or better or more specific to your condition. I kept it very general. There's tons and tons of other things that can happen to the knees and how they can be treated, how they can be managed. But if you're just aware of generally what could be wrong, and do you necessarily need to run to the emergency room tonight, the answer is no. Most of the times it can wait. Even fractures, they can wait until the next day. I'm not recommending that if you might have a fracture, don't go to the emergency room or don't you sit on it. But in general, closed fractures they usually end up waiting. You go to the emergency room, and then the surgery may not be, even if you do require surgery, that may not be the same day or the next day, or sometimes it's 2 or 3 days later. So yes, it's painful, but should not be worrisome. That's the point that I want to drive home. One of the things that you have to keep in mind, which I think I forgot to mention, usually you'll see this in slightly older age, but sometimes people feel pain in their knees, but the knees are, you get an x-ray and your doctor says everything looks perfect, everything's fine, and your pain is still not going away. One is the pain can be coming from a meniscus or ligaments, that can't be seen on an x-ray. We do x-rays just to make sure that it's not the bones, it's not osteoarthritis, like wear and tear. of the bones itself. And if we see that the bones look great, they look young and healthy, it just tells us that the problem might be in the other structures that are holding the joint together. And the meniscus is a cushion. It's like a cushion in between the knees to reduce the impact, like a shock absorber. If that thing breaks, it's called a meniscus. If that thing breaks, usually you'll get a lot of pain. Commonly worse with going up and down the stairs, mostly with going down the stairs. Keeping that in mind. But if the other thing is, if all this looks relatively okay, your pain could be coming from the hips. Hip pain can or will radiate to the knees. So if nothing is picked up and your pain is not going away, go back and see your doctor and say, hey, could it be my hips? And sometimes it is. It just we just need to sometimes look at it, because one of the things the doctors, including myself, we sometimes go with what the patient is saying. Like if the patient says my knees hurt, then we look for the problem only in the knees. But sometimes the problem can be in the neighboring joint. So that's more for the doctors, I guess, to keep that in mind. But if your doctor says your knees are fine, then don't hesitate to ask, could it be my hips? And the answer will more likely be yeah, but let's take a look. And if they find a problem with your hips, then the hip joints, then fixing that will fix your knee pain. And why do I see a lot of people complaining of hip pain, knee pains right now? Probably because the weather got better, people start walking, exercising, running, especially on the streets, and they haven't done this in some time. The days are longer, so you go for a walk and you go for an extended walk, and then you don't realize that you've been walking on the road for much longer than you have done, and then come back with knee pain. So sometimes it's just simple and obvious. And most of these things will get better with rest, ice, and wrapping it, and some Tylenol, and that should help you. So keep that in mind. If there's swelling in the joint, then you want to have it looked at. Some doctors will quickly put a needle in, take some fluid out, and then send it out. That's ideal, but not everybody does it, and there's debate on whether one is classic textbook and the other is more what can I do, what's the easiest way to make things better. But in general, if you have swelling in the knees and then the knee joint is swelled up, you definitely want to have it looked at, and then the doctor will decide if they want to intervene, or they will refer you to a specialist, and how the specialist is going to address that problem. But that usually would be more painful anyways. So that's to keep in mind, and don't forget about Lyme disease. Right now, we're going to start seeing more and more of those cases. Similar situation with other joints. The concept is pretty much the same. What caused it, what's making it worse, and what can we do about it? If you ever have swelling in the knee or any joint, and you also have fever with that, and you feel sick, like you just feel very sick. So it's not just pain, but you feel sick, and you have a temperature. And if that joint is looking red and nasty, and you just touch it and it hurts a lot, that's the time you want to see the doctor, and maybe even go to the emergency room, because sometimes the joint can get infected, and you want to be careful with that, because that has to be treated as an emergency. So those are the cases, but but if you don't have a fever and it's not turning red and it's not hot and you don't feel sick, you're just talking about pain, then most of the times it may not be an emergency. But again, it doesn't hurt to try to make an appointment with your doctor, go see them, and let them decide how to help you best. Don't hesitate to use a cane or crutches if it bothers you. it's okay until you get better, because you want to reduce the stress on that joint. Um, but other topics at some point I do want to bring up are fatigue. Why do you feel tired all the time? What can you do about it? What should be worried about? Because whenever we feel like this, we start worrying that, and then we start reading, and then we start going down this rabbit hole. So throw me as many questions as you want to ask about that, and maybe I can help you. And then mental health is another big topic. It's a very big topic, and I don't generally want to approach it as a lecture. And I would love to hear some questions, and or you want to clarify, or is there something that you read, and maybe I can share my opinion with you, and then kind of that kind of interaction usually I've seen that is helpful, because it'll give, to an extent, it'll give you an answer more specific to yourself, and then surprisingly, a lot of people will have the same question, because we're all human. You know, what we think or what we get worried about, there's always enough people who are worried about the same thing. So if you ask me questions, I'll probably answer that question for hundreds of other people. All right. Well, I think I'm going to end this here. And so get some rest, and then I will see you next week. Thank you. Bye bye.